I would love that too. Okay. Pediatrician knows a lot about not just the body, but the human condition, the psyche of the child. Help us maybe create some ideas or at least some opportunities to have some popcorn things among our staff to say, okay, if we're not going to have some of the normalcy of the world that we all really now miss, that we took for granted, right? Not too many weeks ago, months ago, what do we do to help people's psychological or their heart or their mind and their social and emotional well-being? Are there some tricks from your perspective as a medical doctor, maybe practices we can begin to implement in the learning of children and adults and staff? Are there things that we can do to help people socially and emotionally that we haven't been doing that we should be doing?
Right. I think one of the things that's been missing a little bit is the thing that helps you get through these things are that you know you're doing it for the greater good. And we haven't appealed to that as much as we should, in my mind. I think, frankly, the great enemy out there is COVID-19. It's not another country's military. But there's nothing more patriotic to do right now to help our country than to wear a mask proudly and know that you're doing your part as an individual. That's how we won World War II. It wasn't just the soldiers, it was the people back home who were giving up meat except for one day a week, that were, we had rationed gasoline and we gave up most of our travel. We're asking people to do this. And I think if people feel part of a greater operation that they're a piece of, I think that helps a lot. And we probably need to do more encouragement along that way. I think the classroom is a great level to have that discussion with kids. And as a superintendent and president of the board, I think those are, I know that you guys are doing that anyway, because I know how you operate, and that's something good leaders do. The second thing is acknowledging that people are going to break down every once in a while, and to have permission to do that and resources to be available to address that is really important. And again, I know mental health services in schools and for children is something that we were working on as the American Academy of Pediatrics before COVID-19 came, because we know that Arkansas is a particularly, there's a lot of mental health issues in the state and not nearly the services that we need. But that sort of emergent care that we all provide, and I shouldn't be talking to either of you about this because I know teachers do this every day. I would just say, keep doing it, realize that it's going to be a little bit more than usual, and keep doing what you do best.